Welcome to Unit 3 of the Special Needs Training mandated by the Georgia Department of Education for school bus drivers in the state of Georgia. In this unit, our objective will be to provide the best practice in administering first aid on the bus. First aid is the immediate care given until medical help arrives. As a special needs driver, you should always be aware of any passenger on your bus that has a condition which may require emergency help so you can react accordingly. It is essential that you, the driver or monitor, remain calm, assess the situation, and determine who needs immediate care. If you fail to respond, it may result in a loss of life. Remember to always call for medical assistance. As our performance standard, the trainee should be able to describe the basic first aid principles for controlling bleeding, breathing emergencies, and shock. As an overview, we're going to talk about first aid procedures, how to perform them to make you more comfortable in emergency situations until emergency medical services arrives. We're going to talk about clearing airways, how to clear an obstructed airway, how to treat students who have been injured and are bleeding, how to use universal precautions, gloves, breathing barriers, cleanup kits, etc. We're going to talk about treatment for shock, how important it is for you to recognize the signals and what to do until emergency medical services arrives, and first aid for epileptic seizures, how to recognize the signs and what to do until the EMS arrives. Why is it important to you? It is necessary for drivers and monitors to know first aid because they are the first responders in an emergency situation on their bus. Drivers and monitors know about the children's medical needs that are on their bus. They are the only ones able to provide emergency medical care until help arrives, and we want to provide the trainees the proper instructions and techniques to administer temporary emergency care, so when an emergency occurs on your bus, you can remain calm and know what to do until the EMS arrives. A lack of knowledge may result in a loss of life. Okay, so what do you do in a medical emergency? To determine if a person is unconscious, you will need to tap the person and shout, "Are you okay?" If at that time the person responds, then you at least know they are conscious and breathing. If the person does not respond, then a medical emergency exists and you need to take action. If the person is unconscious, you will need to roll the person carefully onto their back, paying careful attention to keep their head and back aligned. Tilt the head and check for signs of breathing and life. If the person is not breathing, pinch the nostrils shut and using the breathing barrier, if available, seal your mouth around the person's mouth and administer 2 rescue breaths. You should see the person's chest clearly rise each time a breath is given. If the air goes in, check for a pulse in the groove on the side of the neck or inside the upper arm for no more than 10 seconds. If the person has a pulse and is not breathing on their own, continue to give rescue breaths at a rate of 1 breath every 3 seconds for about 2 minutes. Then recheck the person for breathing and a pulse for no more than 10 seconds. If the person has no pulse and is not breathing, CPR is needed at a rate of 30 chest compressions on the center of the breastbone, followed by 2 rescue breaths. Remember, before you do anything, call 911 or your local emergency number. Clearing the airway. Foreign bodies may partially block an airway but still allow good air movement. In this case, choking victims can remain conscious and can usually cough. You should encourage them to cough harder to try to dislodge the object. If the victim becomes unable to cough, speak, or breathe, the airway is completely blocked. Position yourself beside the victim and give 5 back blows between the shoulder blades. If the object does not come out, then position yourself behind the victim and give 5 abdominal thrusts. Place the fist of one hand thumb side up in the middle of the person's abdomen, just above the navel. Grasp the fist with the opposite hand and give 5 quick upward thrusts. Repeat the back blows and abdominal thrusts until the object comes out or the victim becomes unconscious. If the victim becomes unconscious, you may need to start CPR. Again, remember to call 911 or your local dispatch. Nosebleeds. It is always best to practice universal precautions, gloves, breathing barriers, and body fluid kits when coming in contact with body fluids. The process you should follow if a student on your bus has a nosebleed is to place the victim in a seated position if it will not cause any further injury. Remain calm Apply continuous pressure to the bridge of the nose, reminding the person to breathe through their mouth. Have the person tilt their head slightly forward to prevent blood from going down their throat. Have the person continue this until the bleeding is stopped. Do not allow the victim to blow their nose. When controlling bleeding, immediate action is required. A person can bleed to death in less than a minute. When a person has a loss of blood, even a small amount can produce shock. Here are a few methods to control bleeding. Apply direct pressure to the wound with a clean, sterile dressing if available. If a clean dressing is not available, use universal precautions to prevent disease transmission. Use gloves when applying direct pressure to the wound. Elevate the injured part if it will not create further injury. Bleeding may be slowed by applying pressure to the nearest pressure point. Pressure points are located under the upper arm at the brachial artery and at the groin area near the pelvis at the femoral artery. Shock is a condition in which the heart fails to deliver blood containing oxygen to the vital organs of the body, such as the brain, heart, and lungs. This triggers a series of responses which produce the signals of shock. When a person is injured or becomes suddenly ill, normal body functions can be interrupted. When the body is unable to meet its need for oxygen because the body is not circulating blood properly, shock can occur. Some signals of shock are cold, clammy, and pale skin, nausea or disease, irregular pulse, shallow or irregular breathing, dull or hollow eyes. Often shock victims are unaware of what is going on and may collapse. You must attempt to improve circulation and maintain a normal body temperature, which will ensure an adequate supply of blood. The shock victim should lay on their back with their feet elevated above their heart, about 12 inches, if it will cause no further injury. If the victim is having trouble breathing, elevate the head and shoulders so long as you do not suspect a head or back injury. If the person vomits, turn the person on their side to avoid choking. Cover the person with a blanket or additional clothing to maintain normal body temperature. Be careful not to raise the body temperature because this can be harmful. For epileptic seizures, if a student on your bus is having a seizure, you must call 911 or your local emergency number. Here are the steps you can take to ensure the student's safety. Help the victim to lie down if possible. Clear away nearby objects to prevent further injury. Do not force anything between the victim's teeth. It is impossible to swallow your tongue. Loosen clothing around the neck when the seizure slows, and monitor the victim's airway. Do not attempt to hold or restrain the victim. The victim will exhibit jerking and possibly foaming at the mouth. Check the person for breathing and a pulse. If not breathing, but it has a pulse, give rescue breaths at the rate of 1 breath every 3 seconds. If the person is not breathing and does not have a pulse, give CPR if you've been trained to do so. The victim will be sleepy and need to rest after the seizure. The person's clothing may be soiled. Do not question, disturb, or embarrass the victim. And remember, call for help. If a person has a tracheotomy tube, you must give rescue breaths to the person through the tube. Special care and instructions need to be followed with persons with tracheotomy tubes. The tube could become obstructed or dislodged. If this occurs, the tube will need to be replaced or rescue breaths will need to be administered into the hole in the person's neck. Check the person for medical identification bracelets, necklace, or an anklet to help identify this condition. There can be a variety of special medical needs on your bus. A diabetic emergency. For students who are diabetic but can be suffering from either too much or too little sugar in their blood, if the person is conscious and able to swallow, give them sugar, preferably in a liquid form. This is the quickest way to get sugar into their system. If the person is unconscious, do not give them anything by mouth. Call 911 or your local emergency number. When bus drivers are transporting special needs students on their bus, special care may be required. What is DNR? It stands for Do Not Resuscitate. Do Not Resuscitate is a written order from a doctor. If you have a DNR order on a student and that student suffers a cardiac or respiratory arrest, do not attempt to resuscitate. Providing care to such a student could cause more harm than good. Again, call the local emergency number or 911 and follow the instructions on the IEP. It is important that someone on your bus knows what to do to provide proper care should an emergency situation arise. Let's review. How do you determine if a student is unconscious? Tap and shout, "Are you okay?" If a student is not breathing but has a pulse, what do? Give rescue breaths at the rate of 1 breath every 3 seconds. If a student is not breathing and does not have a pulse, what do? Start CPR at a rate of 30 compressions on the center of the breastbone and give 2 breaths. If a student is choking but coughing forcefully, what should you do? Encourage them to keep coughing. If a student is conscious but is not able to cough, speak, or breathe, what would you do? Give 5 back blows between the shoulder blades and 5 abdominal thrusts. What is the first step in controlling bleeding? Apply direct pressure to the wound. When a student is having a seizure, should you place something between their teeth? Absolutely not. What does DNR stand for? Do not resuscitate. Why? DNR orders must be filed on a jurisdictionally recognized form. To be sure that their DNR request is honored, patients should make their wishes clearly known to their family, doctors, community hospitals, care homes, and any other caregivers or healthcare providers who may be present should a cardiac arrest occur. Some jurisdictions provide for a legally sanctioned DNR notification that is clearly visible to all healthcare personnel, similar to a medical alert bracelet. Providing care can sometimes do more damage to the student than good. You play a major role in making the EMS system work effectively. Remember, if you do nothing else, call 911 or your local dispatcher. Get help. In summary, the drivers will have learned the American Red Cross best practice in administering first aid and CPR, what to do to control bleeding and shock, first aid for epileptic seizures and diabetic emergencies. These materials teach the knowledge and skills that are needed to provide care to an ill or injured person until more advanced medical care arrives. How do you apply this training? Red Cross training such as CPR and first aid helps everyday people save lives. This helps everyday people to be able to recognize when an emergency exists and the measures to take until another more trained responder arrives. To measure the performance standard, we will be administering a written test with some first aid questions on it, and we expect an 80% or higher score. Thank you for your attention to this unit. This is Unit 5 of the Special Needs Units. This one is going to be on serious medical conditions. Thankfully, students with serious medical conditions are surviving to school age due to medical and technological advancements. Our objectives in this unit are to identify serious medical conditions, learn how to respond to medical emergencies, and to provide care until help arrives. As a performance standard, as a result of this unit of study, the trainees shall be able to understand the necessity for following medical instructions for the passengers. You will be able to do that based upon the information provided under each category in the objectives and based on the accurate background medical information provided for each student that you transport. As an overview, we will look at the serious medical conditions listed in the Georgia Department of Education Instructor's Guide and learn how to identify signs and symptoms for each. In addition, information will be provided for emergency care for the medical conditions until help arrives. Dealing with medically fragile students and their families requires sensitivity. Why is it important? Drivers and monitors should be aware of the special needs and medical conditions of each student and how to provide emergency care until professional medical help arrives. There's legal responsibility. It is important to remember that it is not our decision as transporters who should ride the bus based upon the Free Appropriate Public Education Related Services Act. The law is clear that we will transport students regardless of the severity or uniqueness of the disability or regardless of the complexity or expense. Specialized training. Drivers and monitors must be trained by approved, qualified medical, technical, or transportation personnel for the adaptive equipment, medical equipment procedures, immediate first aid, and sensitivity. Let's talk about route planning for medically fragile children. Every driver and monitor should be aware of the location of all hospitals and emergency facilities and advanced life support facilities along the route. Even keep a list of the name and the number of the facilities. If your bus was trapped in a complete gridlock of traffic with no way for emergency vehicles to get to you, it might be possible for dispatch or the use of a cell phone to have a nearby facility send someone to walk to your location to assist you in a medical emergency. Sound far-fetched? Being prepared for the worst-case scenario has saved many lives. Drivers and monitors should know how to safely transport medical equipment from one bus to another. Keeping the bus clean for medically fragile students is also important, but avoid strong cleaning products that could complicate allergies and respiratory problems. Continuing with route planning, the seating location for some medically fragile students can be very important, and we'll look more closely at those as we examine each serious medical condition. Remember, sometimes they need to stay away from the doors and windows and not in the rear of the bus. A specific evacuation plan is essential for technology-dependent children. Can they become temporarily separated from life-sustaining medical devices, and if so, for how long? And then also the evacuation bag. After a driver and monitor have learned the specific medical conditions of the students they transport, careful planning for emergencies is important to include the emergency evacuation bag that might contain anything from an ambo bag to suctioning devices, etc. Everyone on board who is capable of understanding should know where the secured bag is located and how to retrieve it quickly for an emergency. Working with medical personnel on the bus. The role of medical personnel on the bus should be clear to everyone concerned. They are assigned to a child, and they are to assist that child only. They monitor and operate medical equipment. They administer medical treatments. They determine if there is a medical emergency. There are certain issues for medical personnel that must be considered. The evacuation role must be clear and practiced. If assigned on the IEP, the student must not be transported without those medical personnel on board. Drivers and monitors should report this to supervision and follow the established protocol for providing substitute medical personnel for the student. Nurses, therapists, or any other medical personnel are vulnerable to injury when not seated on the bus. Monitors and nurses should remain seated unless there is an extreme medical emergency. In that case, the bus driver should pull the bus over and secure it to provide a safe platform for medical procedures to be administered. Medical equipment. Drivers and monitors should have a basic familiarity with the equipment on their buses. Information for each student should be read and any questions asked prior to transporting medically fragile children who use the medical equipment. Who has the medical or technological equipment? How is the equipment attached to the child? Where are the tubes and bags located? How can you properly secure the child who uses a car seat, safety vest, etc., and not dislodge the apparatus? As has been stressed, qualified medical personnel should give training for drivers and monitors that specifically address the individual child. Respirators. You need to know what the alarm needs. The ambu bag. Who needs it? Tracheotomy tubes. Rescue breathing through the trach tube. If the tube is dislodged, what do? Rescue breathing directly into the stoma or possibly through the nose while covering the stoma. Suction devices. How to operate those. Oxygen. How to secure, disconnect, and for how long. And feeding tubes. Colonoscopies and catheterizations have tubes and bags associated with them. You need to know the location and know how to not dislodge those. Communication devices. How to operate and properly secure them. Know how to secure all equipment on the bus and know how to transfer all of that equipment to another bus if necessary. Okay, some study questions. Who should provide specialized training about serious medical conditions, equipment for bus drivers and monitors? Answer, the drivers and the monitors must be trained by approved, qualified medical, technical, or transportation personnel to ensure the safe care of the students and efficient handling of serious medical conditions and the correct use of any necessary medical equipment. Name 3 important factors on route planning for students with serious conditions. Important factors for route planning are essential to provide the safest transportation possible. Examples of things you need to be aware of are knowing the medical facilities along the route, The seating locations for specific medical conditions is important. The specific evacuation planning is essential. Transfer of equipment to another bus and an evacuation bag, who might need it. Medical conditions requiring immediate medical attention. The following slides will name serious medical conditions and tell you signs and symptoms of each. Preventative measures for drivers and monitors and what to do for each condition in an emergency until medical help arrives. And first we look at anaphylactic shock. This can be a major medical emergency due to extreme allergies to food, medicines, bee stings, latex, etc. When a child is experiencing anaphylactic shock, air can't get in or out of the lungs. Asthmatic children are at a higher risk for severe allergic reactions. Anaphylactic shock signs and symptoms. All drivers and monitors must know and follow a student's allergy management plan and have it close by for emergencies. Look at the mouth for itching, swelling of lips and tongue. Look at the throat for itching and tightness and hoarseness. Look for the skin, hives, rash, swelling of the face, hands, and feet. Consider the lungs, shortness of breath, coughing and wheezing. The abdomen might experience nausea, cramps, or vomiting, and the heart might have a faint pulse or a low blood pressure, and they may pass out. So what are some of the signs and symptoms of anaphylactic shock? Swelling of the lips, tongue, face, hands, and feet, itching of the mouth and throat, shortness of breath, coughing and wheezing, nausea, cramps, and vomiting, a faint pulse, or fainting. Anaphylactic shock. What can you do until medical help arrives? Know who has an EpiPen, where it is located, and use it immediately when needed. Make sure you call 911 or dispatch to get help. EpiPens last for about 10 to 20 minutes, and after that the symptoms may return. Make sure that 911 is called any time an EpiPen has to be used. It does reverse the possible effects. It constricts the blood vessels and relaxes muscles. It opens the airways, speeds up the flow of oxygen to the body. Sometimes they'll have twin injectors, and you can use the second injection if symptoms have not improved within 5 minutes of the first injection. Let's talk about asthma. This can be a serious medical emergency. Know the asthma action plan for the student. Good ventilation is important while being transported. Some of the triggers that you see listed on this slide and on the next are triggers that drivers and monitors can take preventative steps to protect the student from exposure. Identify your asthmatic students in advance based upon the medical records provided. Knowing if the student has fast-acting medications such as inhalers and where they are located. Keep the windows closed during high alert days, and keep the bus swept and wiped down. Also, protect them from drafts to avoid colds, etc. Make certain that we do not smoke on the bus, whether or not the students are on board, and making sure that our clothes and hair do not reek of tobacco smoke smell. Outdoor factors. Practice safe idling procedures as directed by your policies. Indoor factors. Dust and perfumes are indoor factors that drivers and monitors can control. In some cases, you may have another student whose parent or guardian will need to be advised of the effect strong perfumes or lotions has on an asthmatic student on the bus. And then there are emotional factors. While nothing makes a driver happier than to know that a student enjoys riding the bus, sometimes laughing too much or too long can cause an asthmatic attack. Avoiding distress for a student is also important because distress could cause crying or yelling that could trigger an asthmatic attack. You may have to be careful who is partnered to ride in the seat with an asthmatic student. When you see signs or symptoms of an asthma attack, act fast. Signs include coughing, wheezing, hard to breathe, tight chest, or pain in the chest, fast breathing or out of breath. Follow the asthma action plans provided by the school. Danger signs of an extreme asthma attack that is out of control. If the student has bluish, dusky color to the lips and nail beds, trouble walking or talking, skin between the ribs or above the breastbone sucks in while breathing, increased heart rate, pulse, nostrils flared indicating difficulty breathing, a quick relief medication such as inhalers do not provide relief. In those cases, and in all cases, you need to call 911 or have the dispatchers contact 911. Until help arrives, Set the student upright or help them to stand to open the airway. Speak calmly, reassuring the student that you're going to help them. Stress oftentimes worsens the situation. Assist the student with the use of inhalers. Provide good ventilation. Protect them from dust and debris. Okay, so what triggers for asthma can the bus driver and the monitor try to control on the bus? Among those things you might be able to control are dust, tobacco smoke, diesel fumes, perfume, laughing, crying, yelling, and other aspects of stress. Let's look at cystic fibrosis. Students may have breathing and heart problems, supplemental oxygen may be needed, and excessive sweating may result in salt depletion. Signs and symptoms of cystic fibrosis: mucus may build up causing excessive coughing and wheezing. Suctioning may be needed to clear the airways, and training is required for that. The student may require a bus with air conditioning. Drivers and monitors can take precautions for students with cystic fibrosis by providing ventilation, protecting them from dust, perfume, cigarette smoke, much like students with asthma and allergies. Precautions for students with cystic fibrosis. First of all, again, call for emergency help. Until they arrive, assist the assigned nurse if applicable. Do not attempt to provide assistance for which you've not been trained. Reassure the student, and you need to remain calm yourself, and provide rescue breathing or CPR if needed. Diabetes. Insulin reaction is a serious medical emergency. Know the diabetes management plan. Know if the student uses a pump and where it is located. Insulin reaction, signs and symptoms of hypoglycemia, which is low blood sugar. It's different from each student and it can vary with each episode. Mild to moderate symptoms is when a student is experiencing mild to moderate hypoglycemia, often referred to as low blood sugar. They may have any or all of the following symptoms: shaky, irritable, nervous, pale, sweaty, headache, blurry vision, disoriented, sleepy, hungry, weak or lethargic, uncoordinated, an inability to concentrate, or they may be confused, a change in personality or behavior. If they have mild to moderate hypoglycemia, until help arrives, give a quick-acting sugar product, 3 or 4 glucose tablets, 3 teaspoons of glucose gel, 4 ounces of juice, 6 ounces of non-diet soda. With severe symptoms, again until help arrives, they're going to show an inability to swallow, seizure or convulsions, or unconsciousness. Until the help arrives, administer medications if authorized and trained to do so. Turn the student on the side and allow fluids to run free from their mouth. Call 911. Make sure you get help. Let's talk about hyperglycemia, which is high blood sugar levels. When a student is experiencing hyperglycemia, often referred to as high blood sugar, they may have any or all of the following symptoms: an increased thirst, frequent urination, nausea, blurry vision, and fatigue. Hyperglycemia treatment, until help arrives, is to provide care to the extent that you're trained. Do not restrict fluids. Sometimes you may have to alter the bus rules. Some students carry extra drinks or water with them, and you should carry a bottle of water just in case. Attempt to provide the restroom facility. If this becomes an ongoing situation, seek advice from your supervisor. The student may require a monitor to be assigned. Notify the school or the parents. Always let the school or parents know that the student has experienced an episode and monitor closely. Okay, hypoglycemia means and hyperglycemia means. The answer is hypoglycemia is low blood sugar. Hyperglycemia is high blood sugar. Let's look at students with congenital heart malformations. If a student has this condition where the impaired heart walls or valves, this is where a student has a condition where impaired heart walls or valves cause malfunction and progressive damage. Many students with Down syndrome have congenital heart malfunction, and that can lead to congestive heart failure. Continuing on with our discussion of this, bus drivers and monitors must have a written medical emergency plan, and both must know how the plan works. Training for required medical devices the student may have to use should be provided by qualified personnel. Nurses are often required on the bus for students with CHM, If required on the IEP, do not transport the student without the nurse. Ongoing symptoms of congenital heart malformation include cyanosis, which is blue color to the lips, fingernails, and skin, a shortness of breath. Some of these students may require the use of supplemental oxygen, and if that's the case, the drivers and monitors must be trained to use and store the oxygen safely. Due to the student's decreased stamina, they may require the use of a wheelchair or other mobility device. These students should be protected from extreme cold temperatures and draft due to their susceptibility to respiratory infections. Students with congenital heart malformation who are susceptible to congestive heart failure must be closely monitored on the bus, oftentimes assigned a nurse or a properly trained bus monitor. The following symptoms would require immediate emergency care: difficulty breathing, fatigue, swelling of the arms and legs, weight gain from fluid retention, headache, dizziness, and a lack of appetite. If you see these symptoms, call 911 or dispatch immediately. Follow the emergency care plan. Use a calm, reassuring voice. Provide rescue breathing or CPR if needed, and be aware of whether or not this student has a do not resuscitate order in place. Hemophilia. Some students with hemophilia may not be assigned to ride special needs buses. However, a student with this medical condition should be identified to all bus drivers and bus monitors. Some indicators of this disease are blood fails to clot, excessive internal or external bleeding may occur, any injury to the head or neck is a top medical priority, and the student could stop breathing or rapidly sustain brain damage. There are certain precautions that drivers and monitors can take when a student has been identified as having hemophilia. Carefully assign the child's seat. If there is no monitor on the bus, the student should be seated near the front of the bus so the driver can observe the student easily and can get to the student quickly if there is an injury. Be careful who the student is partnered with in the seat. Pick other students who are not aggressive or have a history for harming others. Monitor boisterous behavior. Students with hemophilia are children first and want to do everything else that other students do. We have to keep our eyes and ears open to ensure that students with hemophilia do not behave in a way that can cause injury to themselves. Help the student to avoid slips, trips, and falls on the bus steps by requiring them to use the handrail when entering or exiting the bus and to take their time. Drivers and monitors must inspect the bus daily for sharp edges in the aisle or protruding objects from book bags, etc. Securement equipment for wheelchairs should be put away when not in use. If the student has any severe episodes of the following symptoms of internal bleeding, the only treatment is to call 911 or local emergency numbers immediately and to remain near the student until help arrives in the event that you may need to provide rescue breathing or CPR. Look for headaches, sleepiness, nausea, vomiting, unequal pupil size, slurred speech, disorientation, or confusion. If a student with hemophilia has visible external bleeding, use first aid. Be sure your body fluid cleanup kit is stocked and available so you will have access to protective gloves and sterile gauze. You might request a supply of larger gauze pads to have on hand for this student. Apply direct pressure to the area. Elevate the portion of the body that is bleeding if at all possible. Use pressure points on the body if necessary. Call 911 or a local number if the bleeding is profuse or cannot be controlled. Always report even minor occurrences to the parents or the school. What are some of the precautions that bus drivers and monitors can take on the bus with students with hemophilia? Carefully assign the seat and seat partners. Monitor boisterous behavior. Help the student avoid slips and falls on the bus steps. Inspect the bus for sharp edges and put securement equipment away when not in use. Let's talk about juvenile arthritis. Juvenile arthritis is a painful disease for students. It requires attention to detail and patience from the drivers and the monitors. The student may have painful and inflamed joints. The severity of the pain may vary from day to day. They may have poor posture due to the pain and in some cases deformities. Their bodies may appear to be drawn. They experience muscle weakness. They will often have poor balance and diminished protective reflexes if they fall. Their movements may be slow because they are afraid to move because of pain. Another symptom for this disease is a lower blood clotting factor, which could result in prolonged bleeding if injured. and students with juvenile arthritis can experience heart failure. Because of fluctuations in the disease, the student may use a wheelchair one day, walk or use a walker, crutches or cane the next, and the type of assistance required will vary or rotate. The student may need assistance entering or exiting the bus. You can protect and provide the student from the front and the back by having the assistance of a bus monitor, a teacher, or a parent. Protect the student from slips, trips, and falls by requiring the use of a handrail when applicable, and by always encouraging them to take your time. You may see a difference in the range of motion for the student in the morning when their joints tend to be stiffer. Protect them from drafts. Because the disease is so painful, seat the student near the front of the bus whenever possible for the smoothest ride. Report the student's complaints of pain and discomfort to a parent or the school. If there is a medical emergency, call for help. Kidney and urinary tract disease precautions. Follow any specific instructions you are provided about this student. Ask questions for clarification for anything that you do not understand. If the student is on dialysis, they should not be given any fluids. This information would need to be provided by the parent or the school. Some students have a catheter tubing that must be protected. Take time in assisting a student who requires specialized seating in order to not pinch or dislodge the tube. And again, for medical emergencies, call for help. Leukemia is a blood cancer. Some students with leukemia may not need the services of a special needs bus. Others may be more severely affected or in stages of progression that would require more closely monitored transportation. The student may experience anemia. They may have low amounts of blood clotting cells, and the student's immune system may be affected by the low white blood cell count, which can result in their body's inability to fight infections. Drivers and monitors should practice and encourage other students to practice protective hygiene, washing hands often, keeping a small bottle of hand sanitizer in the event if needed, sneezing or coughing into a sleeve or elbow area to avoid contamination of your hands, and using tissues when necessary. Symptoms of anemia include paleness, fatigue, shortness of breath, and decreased activity or tolerance. Drivers and monitors should report any of these symptoms observed to the parent or the school. Other symptoms of leukemia: any of the following leukemia symptoms you become aware of while transporting the student should also be reported to the parent or school. Easy bruising, nosebleeds, bleeding gums, frequent infections or illness and fever, swollen glands, joint swelling and pain, and weight loss. Central nervous system involvement is not uncommon for students with leukemia, and symptoms of that include irritability, nausea or vomiting, headache, blurred vision, personality changes, changes in the level of consciousness. Call for help immediately and report student complaints to the parent or school. Be prepared to provide rescue breathing or CPR. Brittle bone disease. Children with this typically have bones that break easily and may suffer from multiple fractures following minor pressure or stress. They are usually short in stature and may appear exceptionally thin even when receiving adequate nutrition. Special training for working with students is required in order to avoid unnecessary damage or breaks. Occupational and physical therapists who work with the students at the school are a valuable resource for bus drivers and monitors. Students with this condition should be given priority consideration for seating on the bus to provide the smoothest ride possible, preferably at a halfway point between the front and the rear axles of the bus. Careful consideration must be given to considering who should be sitting next to a student with this condition. If the student uses a wheelchair or other type of mobility device, specialized seated, or uses assistive equipment, time and patience are required in securing the student safely without injuring them. Careful evacuation planning must be done for students with this condition, but ultimately, if the students must be evacuated quickly, injuries may occur. Report student complaints to the parent or the school. What are some precautions bus drivers and monitors can take on the bus for students with brittle bone disease? Be properly trained for dealing with these students. Consult with a physical therapist or an occupational therapist for advice, and be careful in your seating and securement methods. Let's talk about special concerns for drivers who are dealing with students with these severe medical situations. Drivers and monitors fall in love with the children in need. You need to exhibit sensitivity to the parents. Be positive and uplifting. They need it. Be sensitive when communicating with students who are medically fragile. Don't assume that they won't understand everything you're saying. Be positive and provide hope. Follow the approved policy for transporting medication and documenting the chain of custody. You must follow the do not resuscitate policy. When there are medically fragile students on your bus, there is always the possibility that they will have to stop riding the bus for extended periods of time or stop riding the bus forever. The student may not survive, and this could be very emotionally upsetting for other students on the bus. Seat partners or other students on the bus may have questions or concerns. They may be sad or depressed at the loss of a friend on the bus. Drivers and monitors should keep the school and the parents informed as to situations occur and seek advice for providing answers to the remaining students on the bus. It is ultimately the parent's responsibility to prepare their child for the loss of a friend, but you want to be prepared to address their concerns without compromising the parent's wishes. It is important for drivers and monitors to understand the stress that goes along with transporting medically fragile students and terminally ill students. You too may need counseling to deal with the loss of the student. School counselors are available, counseling through your place of worship or private counseling, but do not discount the effect of losing a child may have on you. You still have an obligation to be your best, 100%, when transporting your students. Who should ultimately make the decision as to how best to prepare a student for the loss of a friend? And the answer to that is the parent or guardian. In summary, carefully read and pay attention to all the information on student medical records that are provided to you. Drivers must have basic knowledge and training about their students' disabilities or medical conditions to provide the best care during transportation. Specialized training should be provided by qualified medical or school personnel, and this training must be documented. Some students with serious medical conditions have specific medical plans for students as a part of the IEP. Drivers and monitors must read, learn, and follow the plan. Evacuation planning should be done by drivers and monitors together, and each should fully understand their role and ensure that any other school or medical personnel assigned to ride the bus understands their role as well. This will avoid confusion in the event of a real emergency. Know if you need an evacuation bag, and make sure that everyone on the bus knows the location of the bag. Drivers and monitors must exercise sensitivity on the bus and when dealing with parents. Speak positively. Never talk about a student as if they were not present, and always speak in terms of what is safe for the student. How do you apply this training? This training should be applied daily for transporting students with serious medical conditions. The information should be received periodically to keep the driver and the monitor prepared. The information should be reviewed when receiving a new student with serious medical conditions. Drivers and monitors should ask for information for any condition or equipment that they do not understand or have not been trained to transport. As a measure of performance, we will have some questions on the written test for medically fragile students. Thank you for your attention to this unit. Please take the time to review this unit and refer back to any written information that has been provided to you, as your students' needs may change on the bus from year to year and even from day to day. This is Unit 10 of the special needs portion of the mandated training for school bus drivers in the state of Georgia. In this unit, we're going to be discussing the emergency evacuation procedures for special needs students. Our objective is to understand the reasons for evacuation, know the special needs issues that must be considered, know the methods of evacuation, know how to develop written evacuation plans, and the planning and the practice of the evacuation drills. As our performance standard, the trainee shall be able to design and carry out a detailed plan of how to evacuate special needs students from a school bus. For an overview, we're going to talk about preparing for emergencies, reasons to evacuate, types of emergencies, knowing your bus and your students, preparing and practicing evacuation plans, and the driver and the monitor as a team. Why is it important to you? The drivers and the monitors are required to know the planning and the carrying out of emergency evacuations. The drivers and the monitors train and practice evacuations with the students, depending on the students' abilities. And finally, the drivers and the monitors need to understand that they can save the lives of the students who depend upon them for protection. Reasons for evacuation. Drivers and monitors must be able to assess the need to evacuate, remembering that unless any of the following conditions exist, generally students are safer on the bus than off the bus, being together and protected. Reasons for evacuation would include the bus being on fire or near fire, there might be a natural emergency, or the position of the bus, such as being near water, near or on a railroad track, near a steep cliff, or in danger of being hit by another vehicle. Preparation for emergencies. Fire dangers must be taken seriously when transporting children with special needs. Sometimes their limited ability to understand verbal instructions or their physical inability to move on their own create situations when the driver and/or the monitor must move quickly and initiate every action taken. Time is of the essence. Buses can burn quickly in some situations. Toxic smoke and fumes can be lethal. Do you have a written evacuation plan? Drivers and monitors should study and know the plan from memory. They should be able to tell how to evacuate each student on each route that they have without hesitation and without reading the plan. No time for reading when the real emergency happens. Types of bus emergencies. Collisions. Those would be resulting in the bus not being drivable and students needing to be transferred to another bus or emergency vehicles. Fires. As we discussed on the previous slide, time is of the essence. Act quickly and evacuate at the safest point of exit away from the fire source. This can be a fire to the bus or on another vehicle with which the bus has collided. Breakdowns. Students will need to be evacuated to another bus. Breakdowns or mechanical malfunction can occur at very dangerous locations. The driver and monitor should exercise extreme caution around traffic and road conditions. Immersions. Some immersions may not be avoided, such as when a vehicle hits the bus and pushes the bus into a body of water. But most situations can be avoided by drivers recognizing and routing around dangerous situations. Drivers should never drive in areas that have been marked no passage or road closed. In addition, drivers should not drive through ditches, flowing current, or flooded bridges. Radio dispatch if there are any questions as to a safe passage through flowing water or over bridges. Electrical lines. If electrical lines come in contact with a bus as a result of a crash or an ice storm, all passengers should stay inside the bus. Stepping off a charged bus can be fatal. The two-way radio can be used to call for help. If immediate evacuation is unavoidable, then passengers must exit so that they don't touch the ground and the bus at the same time. And finally, a disabled driver. A number of incidents occur every year in which a school bus driver becomes unconscious or is otherwise disabled by a sudden medical emergency. If available, a monitor's ability to stop and secure the bus is critical in such incidents. There are some students who ride special needs buses that are perfectly capable of being trained to apply a service and/or a parking brake if necessary. Bus driver and a monitor's responsibility after a crash. Drivers and monitors should follow the accident procedures outlined in the regular ed unit number 10 under the bus driver training curriculum. Everything that a bus driver knows about emergency evacuation procedures, the bus monitor should know as well. Everything. Remember, 3 minutes or less to evacuate in order to avoid serious injury. Written evacuation plans. Plan for 3 emergency situations: engine fire, rear fire, and a rollover. Every route transporting children with special needs has unique characteristics, so plan ahead for them. The purpose of a written evacuation plan is to clarify who does what. No plan can cover every contingency. Evacuation planning is important. Never put a student on the bus without having a plan for getting them off safely. Drills or simulated drills must be done annually. The drills should be scheduled through the transportation department, and they should be done on school property. Keep the directions simple. There is a front door evacuation drill, rear door evacuation drill, lift assisted or non-lift assisted for non-ambulatory students. Evacuation bags. After a driver and a monitor have learned the specific medical conditions of the students they transport, careful planning for emergencies is important to include an emergency evacuation bag that might contain anything from an ambo bag to suctioning devices, etc. Everyone on board who is capable of understanding should know where the secured bag is located and how to retrieve it quickly for an emergency. Know your bus, stopping and securing the bus. Applying the service brake. Drivers should be certain that monitors or assigned medical personnel, chaperones, or capable students know how to apply the brake pedal in order to slow and stop the bus to ensure that no matter who may be injured or disabled, there would possibly be a person as a backup operator to stop the bus and possibly avoid a crash. Applying the emergency brake. If at all possible, the bus should be slowed to a safe speed or stopped by the service brake before the parking brake is applied, and all those trained to apply the service brake should be trained by the driver on how to apply the parking brake. Continuing with what you should know about your bus, consider the communication. Learn how to key the mic. Drivers should teach the monitors and any other capable students how to use the two-way radio effectively. Let them know if electrical power is required to operate the radio and show them how to turn the power on. Press the mic to speak and release to hear. When pressing or keying the mic, wait 3 seconds to speak so the beginning of the transmission will not be cut off and require repeating. Hold the mic a few inches from the mouth and speak slowly and clearly without yelling. Yelling or holding a mic too close or too far away may require all the information to be repeated due to distortion, and valuable time could be wasted. Activating the four-way hazard lights. Show everyone where the hazard light switch is located and how to operate. Setting up triangles and reflectors. Drivers should show adult riders and students who are capable how to set up emergency reflective triangles. Reflective triangles should be removed from the holding carton periodically for the purpose of making sure they're not stuck together and difficult to manage. This can happen during extremely hot or cold conditions. Over time, the triangles can become damaged. Using the seat belt cutter. Drivers should show those who are capable where the belt cutter is located on the bus. If cutting a belt is necessary, the belt should be pulled tight and cut at an angle. Using a fire blanket. If time permits, the driver or monitor can use a fire blanket for the purpose of evacuating a student who is not ambulatory or conscious. Using the blanket may be especially helpful with heavier students or an adult. Know where the blanket is stored, how to access it, and unfold it quickly. Moving the student without a fire blanket. If getting to the fire blanket is not an option, the driver and the monitor may have to drag the student out the back of the bus without the blanket, being sure to protect the head and the neck. Learn how to open all of the exits. Drivers and the monitors should know the location and operation of roof hatches for full opening in the event of an emergency and other exits are blocked or inaccessible. Learn how to go out all the exits. Should be feet first and face down is the safest way to go out an emergency exit window. Drivers and monitors should also sit and slide in order to avoid injury that would prevent them from helping the students. Okay, some review questions. What are the 3 reasons to evacuate a bus? Bus is on fire or near a fire. There might be a natural emergency, or there may be an issue with the position of the bus, such as it being near the water, near on a railroad track, near a steep cliff, or in danger of being hit by another vehicle. What are 5 things a driver and monitor must know about their bus in order to carry out a timely, effective evacuation? Stopping and securing the bus, using the radio, activating four-way flashers, setting up triangle reflectors, using a seatbelt cutter, using a fire blanket, learning how to open all the exits, and learning how to go out all of the exits. Okay, now you know your bus, now you need to know your students. Determine who could be helpers. Read the student profiles that are provided to you about each of your students. Ask questions from the parents and teachers that help you better assess the students' abilities. Observe students on your bus carefully and at every opportunity to determine if they could assist you in an evacuation. Some students' disabilities will not permit them to participate in emergency evacuation drills. They may be medically fragile, using life-sustaining equipment, or could be autistic and resistant to change of any kind in their routine. There could be any number of reasons why a special needs student could not participate. Drivers and monitors can seek information from parents, teachers, and student profiles to make this determination. Maintain written permission forms from parents for helpers in drills. Written permission forms are best means of protection from liability when determining who can be helpers and who can participate in emergency evacuation drills. Continuing with what you need to know about your students, Keep medical records together and accessible. Have a predetermined location on your bus that is known to your Transportation Administration in the event of an emergency where the driver and the monitor may be incapacitated and unable to provide information. Transportation Administration can make your local emergency medical technicians and law enforcement agencies aware of where the information is stored on the bus. Know who uses medical life support equipment. This information for some students is obvious, such as an oxygen tank or a respirator. For others, you learn about this from the student profiles and the parents and the teachers. For example, a feeding tube that is underneath the student's clothing. Can the student be disconnected from life support? If so, for how long? If a student cannot be disconnected from life support, the driver, monitor, and nurse, if assigned, should have a definite plan for evacuating the student with life support if time permits, and should have an evacuation bag for the student if time does not allow the evacuation of life support equipment. Know which students might panic and run. It may be determined that a student who will panic and run should be transported in a safety vest or at a minimum a seat belt so that the driver and monitor can have some control until such time as they can enact their emergency evacuation plan, which should provide for the student to be held by the hand and led or possibly picked up and carried, depending upon the circumstances. A calm, reassuring voice and a look on the driver's and monitor's faces is very important. Using a leader rope can help drivers and monitors keep up with the students who may be frightened and want to run. A leader rope can be made from a simple cotton clothesline rope and hair scrunchies, stretchy ponytail bands. Just tie the scrunchies to the cotton rope, leaving space between to allow ability for students to walk together safely. Evacuation techniques. Evacuation should be a last resort, but if a fire is suspected, don't hesitate, evacuate. Decide on the best exit for situations. Front door, rear door, both doors, and emergency exit windows. Shut the engine off. Utilize bystanders if available. If there are downed wires and no danger of fire, stay on the bus. Shut oxygen off if fire dangers exist. Consult with the IEP team when creating an evacuation plan. Reassure the children and release the belts or the straps. Cutting belts may be necessary. In that case, use the seatbelt cutter. You may need to use a blanket to drag with heavier children. The driver and the bus monitor work together to lower children to the ground. Move children to a safe distance from the bus. Retrieve wheelchairs after children are safe, only if it is safe to do so. Okay, fill in the blanks. For efficient evacuation planning, drivers and monitors must know their blank and their blank. The answers are that the drivers must know their bus and know their students. What are 4 ways to exit a school bus? Front door, rear door only, both doors simultaneously, and with the emergency exit windows. There's also roof hatches, and the windows with black gaskets can oftentimes be kicked out. In summary, we've talked about the importance of knowing your students, knowing your bus, preparing and knowing your evacuation plans, practicing, and having the bus driver and the monitor work together as a team. How do you apply this training? Apply the training daily by having a plan for every student that you transport based upon their needs, and also apply it regularly by practicing or reviewing your evacuation plans with your students to the extent that it is possible in order to be prepared for emergency situations. How are we going to measure the performance standards? Trainees will be expected to plan 2 emergency evacuation drills based on scenarios with 2 groups of students with different disabilities. Trainees should demonstrate their ability to locate and operate all emergency exits and evacuate a student mannequin by using the evacuation blanket and by actually evacuating a student mannequin in a wheelchair. Drivers and monitors must be able to verbally describe their recorded emergency evacuation plan for all students they transport. Thank you for your attention to this unit. Please take the time to review this unit and refer back to any written information that has been provided. Update your evacuation plans when your student population or seating placement changes.